Good morning and thank you for joining us. My name is Tina T-Bone. I will be your moderator for this morning's news conference. Joining us today, the Premier of Nova Scotia, Premier Stephen McNeil. Go ahead, Premier.
Good morning, Tina. Before I take any questions, I just want to, first of all, comment on PAC today. Public Accounts, Deputy Minister Rayfuse was there, laid out the global number that we have spent on stimulus. I want to thank him and all of his colleagues across the public service who have been working tirelessly for the last 9 months to ensure not only could we deal with the issue of COVID, but the fact that our economy was continue to function and where we could provide employment for Nova Scotians and build infrastructure, quite frankly, that will allow us to find our way back to the stable economic health we had coming into this. Quite frankly, we're encouraged by the numbers that we're seeing when you compare our province to the country, not only on the COVID side, but economically. I'm very proud of the work that they've been doing as well, quite frankly, as so many Nova Scotians. I will say this to you, if you are looking for specifics on the additional stimulus money, you'll need to talk to the Department of Agriculture, Department of Community Services, Department of Business, Department of Education and Early Childhood, Department of Health and Wellness, Department of Justice, Department of Labor and Advanced Education, and Department of Transportation and Infrastructure Renewal. They will be able to identify to you where they would have spent the money that would have gone to their respective departments on stimulus. It was my hope, quite frankly, that I could keep them focused on delivering the services that Nova Scotians have expected in the last 9 months, and it was quite frankly my hope that those of you that are listening could have actually gone to the tender board and done your work, but unfortunately those Nova Scotians that are responding to the citizens of this province and working on their behalf every day had to do your work as well. So feel free to call them.
Again, a reminder, we'll take one question and one follow-up in the allotted time that we have for today. We will start with Natasha Pace from CTV. Go ahead, Natasha.
Thank you. Premier, could I first get your reaction to the cuts at the Sydney airport and the loss of service there?
Listen, obviously it's devastating for Sydney and indeed the province. If you go back and look at the last 7 years, we've worked very hard with our partners at the airports and, quite frankly, airline services across the country to build international connections, but also regional connections, whether it was a flight from Air Canada out of Sydney to Montreal, added to the one going to Toronto, whether it was the flights that were coming in and out of both of our airports. They were a major part of the economic success that we were having. It is my hope that when this pandemic is behind us and the vaccine is out there, that we not only find the airline services being connected back into our airports and within our region, but across the country, that we go back to what we had, which was a competitive airline sector. And in order for that to happen, it's my hope that the national government will lay out a program specific to airlines to ensure that both of our major carriers and others are still here to find our way back to a competitive market when people start traveling again.
Go ahead with your follow-up, Natasha.
Thank you. There were 6 new cases of COVID announced today, all of them in the central zone again. What kind of message do you have to the rest of the province? A lot of people still feel like the virus isn't in their community.
As I've said many times, every Nova Scotian should feel like that virus is outside their door. And quite frankly, this virus is moving so quickly. We should be going by the idea that this is outside of our doors. There are many Nova Scotians who are essential workers moving in and out of our province. My message to all Nova Scotians really is to stay committed to the public health protocols. Do what we've been doing. We are, we announced yesterday about a vaccine that'll be here. It was approved, my understanding, today by Health Canada. We have 2,000 doses coming. We've worked so hard as a province to deal with the issue of COVID and to keep it away. Let's not let our guard down now when we're right at the cusp of being able to get this vaccine and put it out and ensure that Nova Scotians and all Canadians get that let's not falter as we're heading towards a finish line. This is what we've been trying to do as a group, as a province. And I would say collectively, we should all be proud of the fact that globally, people are looking at Atlantic Canada and looking at what's happening here in our province and applauding the effort of public health and the effort of Nova Scotians when it came to ensuring that we've been able to deal with this issue of COVID and the virus. Let's just continue to be kind to one another and continue to support one another and recognize that when we follow the public health protocols, we're actually protecting each other.
Next, we'll go to Keith Doucette from the Canadian Press. Go ahead, Keith.
Good afternoon, Premier. I wonder if we can continue along the COVID line. I wonder if you have an update at all on what's happening at the poultry plant in the Annapolis Valley, and can you identify it? And if you can't, why not?
So I'm not sure what you mean. I'm sorry, I didn't mean to your last question, the last part of that question, Keith. Identify what?
What I asked was, is there an update on what's going on with regards to the testing? And then it wasn't identified yesterday which plant it was, and I'm wondering if you can identify it, and if you can't, why you can't do that.
I thought it was identified yesterday by Dr. Strang, but you know what? I'll double check that if you don't mind, and get back to you. I think it was, but I'll just double check in case there's a reason I can't say that out loud. But I'm pretty sure it was. But I will tell you that the employer and the employees are all cooperating. The plant is down today. Our testing, we've gone out into the community with the rapid testing. That is happening right now, still ongoing. And as of just before I came down, of the tests that have been done so far today, there were no reported cases associated with it.
Go ahead with your follow-up, Keith.
All right, and you've got a First Minister's Health meeting on Thursday. Just wondering what the province is seeking to get out of this meeting, and how you think this will go based on what all provinces' needs are going into this meeting.
Well, if you go back to when the National Healthcare Program started, it was 50-50. The federal government paid 50 cents of every dollar associated with the delivery of healthcare. We are now in this province, and it's pretty similar across the country, where the federal government is paying 20 cents on every dollar. I want you to think about that. Our partner has reduced its funding coming into healthcare over the last number of decades. Quite frankly, and the cost of delivering healthcare has done nothing but go up. The pressure that is being provided, not just on this province, but indeed every province in the Federation when it comes to delivering healthcare is not sustainable in the current model. What we're asking the federal government to do is come to the table and offer 35% of funding. We're not even asking them to go back to the 50-cent dollars. We're asking them to provide 35 cents on the dollar, which currently they are doing 20. It would be my hope they will see this as an opportunity, I think, to become more of a partner with us when it comes to the funding of healthcare. And I am open to a discussion. They can target all that funding if they want to, specific aspects that they want, whether it is mental health, whether there's wait times, they can determine if that's what they so choose. We just need them to increase the level of funding so that we can continue as Canadians to be proud of a healthcare system. And one that, quite frankly, is the envy of the world. But in order for us to deliver that, we need a partner at the national level. And I want to say it's not just this federal government. This has been happening through successive national governments when it comes to the healthcare funding. So, but it is this government that has an opportunity to begin to change that conversation. And if you look at it, this is not, we've as premiers have reached out to all federal leaders. This is not a partisan issue. This is a Canadian issue, and we need to continue to invest in healthcare because it is the #1 priority of Canadians, and it is something that we need to continue to nurture to make sure it becomes and stays a model of healthcare that the rest of the world envies.
Next, we'll go to Jesse Thomas from Globo.
Thank you. This is a question regarding the vaccine rollouts. And Premier, I'm just wondering, We kind of know a little bit of a macro kind of timeline and how it's going to look with the first, 1,950 doses of the Pfizer vaccine coming in, but there's some concern maybe with how complicated this is. It's one of those vaccines that needs to be kept considerably cool. I'm just wondering what the province's plan is to address the cold storage issue, how we're going to address that. I'm wondering if the military will be assisting in this first way through. And I guess I'm just wondering, will you be getting this first vaccine as well?
So the military will definitely be part of that. We've had a team inside of government working on the distribution of this vaccine and future vaccines that come in. We were out to secure freezers that we could be strategically placed in parts of our province. This first vaccine has to be kept at minus 80 degrees. It is also a requirement by both Pfizer and the national government that in this first wave, for us it's 2,000 vaccines we'll get. They have to be near the shelter or the vaccine place needs to be next to where that freezer is. So obviously that'll be here in Halifax, and we'll then start vaccinating in the order that Dr. Strang laid out with public health. And as far as I go, when I get the vaccine, it'll be when the order comes up that somebody 56 to 60 gets to have it. That'll be me.
Go ahead, Jesse, with your follow-up.
Thank you. I guess in regards to the Air Canada announcements of more service cuts, and as we're seeing this industry really struggle, and it's almost putting us into a really tough spot in terms of being able to move about. I know you mentioned to my colleague Natasha that we're looking for federal support to help this industry, but I'm wondering in this difficult time, what's the province doing to ensure this industry remains viable and helps Nova Scotia's economy going forward?
Well, clearly, this is a national. This is a national sector. It requires the national government to participate in whatever that looks like. Provincial governments do not have the capacity, quite frankly, to be able to do that. We know that the Atlantic bubble, the restrictions that we have in our province have obviously been impacting this sector. But I think if you look at travel in general, whether it's our restrictions or the restrictions at the Canadian border around international travel, is having a huge impact. I just go back to the point that for the national economy, we need a competitive airline industry, and I would argue Atlantic Canada, more than any other place in this country, needs a competitive airline industry. The success that we've been able to generate over the last number of years in terms of economic growth and direct flights in and out of here, exports in terms of our product, has been directly related to those sectors and the competitiveness of those industries. Where I think the province can play a role will actually be on the as we come out of COVID. We work with our partners at the airport to invest in direct flights in and out of here, working with airline carriers. But in order for those sectors to be viable, to survive and find their way through, it will require the national government to step up with them, whether it is through loan programs, whether it is other forms of investing with the sector. And for us, we would just want them to have have provisions around that. There needs to be a systematic plan. If we're going to keep these industry afloat, there needs to be a systematic plan as what does the next 4 or 5 years look like in ensuring that we return to the regional services that we as Atlantic Canadians deserve and quite frankly expect. And then allow us to make those connections to the international market.
Next, we'll go to Mike Gorman from CBC. Go ahead, Mike.
Thanks, Premier. The announcement came today that the fee codes for virtual care are being extended again by another 3 months. I'm wondering why the province keeps extending these in short bursts as opposed to simply making them permanent, given the level of interest and uptake that these services have seen.
I don't think there's ever a question that they won't be permanent. The question is, like any service that we're delivering, we're working with the physicians to iron out any issues that may have happened. That is our adjustments, are all of the current things that fall under that fee code, are they appropriate? That's all that's happening. This is not, it's quite frankly prudent management between the department and Doctors Nova Scotia, but what does that look like? But there's been no talk that this service will not be available to Nova Scotians, as you said in your comments. Nova Scotians are quite frankly liking it, and healthcare providers like using that service.
Go ahead, Mike, with your follow-up.
Thanks. Just a quick vaccine question for you then. Appreciating the requirements that Pfizer and the feds have in place for at least the initial rollout of that vaccine, have you got a sense yet from public health as to when people outside Central Zone might start to see access to vaccine within their own communities?
Listen, I think this first 2,000 that are coming in, we're going to learn a lot of lessons from it. The infrastructure is going in place where we can distribute that, but at the same time, if there's a requirement that we can only do that here, then we will actually bring the respective people in who are required, which is frontline healthcare workers, and then continue to work our way through that list to ensure that we could roll that out. But this first 2,000 that are coming in, as we did yesterday, there was a mock exercise using dry ice just to be able to do a dry run with our partners, and the same thing will take place with this 2,000. And as we learn and gain experience from it, it will begin to be distributed. But if the issue is that it has to be here, then we will have our healthcare workers come to us.
Next, we'll go to Andrew Rankin from the Chronicle Herald. Go ahead, Andrew.
Hi, Premier. It appears the current COVID outbreak is being brought under control. However, we understand that the vaccine won't be broadly available in Nova Scotia until at least June. So my question is, what specific new steps is your government taking to increase enforcement of the 14-day quarantine for people entering the province so that we can minimize the chance of another widespread outbreak before a vaccine is available?
I'm not sure I understand your question. I can tell you, we work with public health through this process about when we can, whether it is tightened down or change restrictions. As you know, we went through the first wave. We had, really a closure of the service side of our economy for months. We reduced those, lifted them, opened them with some other restrictions associated with the number of people that could be in a restaurant, all of those types of things. Currently, this time around, because of the outbreak that happened here, we were able to isolate and really reduce contact in the capital, part of our province, capital city, and we will continue to work with public health all the way through to change restrictions. If we see something happening in a particular part of our province, we will respond to that. Very much like to Keith's question today about what happened at a job site where we closed it down today and are moving in there rapidly. That's where we've been changing the way we deal with COVID from the very beginning. And so we'll continue to monitor, continue to have people who are coming outside of the Atlantic bubble to isolate for 14 days, and we'll continue to do that.
Go ahead, Andrew, with your follow-up.
Will you commit to providing public information on enforcement activities so that Nova Scotians have confidence that people coming into the province are following the law and are isolating?
Well, I completely disagree with your question altogether. Nova Scotians have great confidence in the ability that we're working together dealing with COVID. We'll continue to do that. People who are being fined, it's been public knowledge. That's not something that I would do. It's law enforcement does it. But the question is just completely inaccurate. Nova Scotians have a tremendous amount of confidence in each other and how they're dealing with this issue. I just need them to stay committed to one another as we deal with the remaining months of dealing with COVID.
Next, we'll go to Brian Flynn from All Nova Scotia. Go ahead, Brian.
Hi, Premier. Ian Rankin said this week he was prepared to move forward with some of the Leahy report reforms, but he didn't get approval from government. I'm wondering if you could tell me if that's correct, and if it is, why did government not proceed with an initiative that you promised during the 2017 election campaign?
So first of all, I'm not getting in a back and forth with you or any other reporter about what a potential successor of mine and leadership candidate has said or hasn't said about the government. I will tell you, Leahy was laid out. We were on moving forward. Obviously, COVID hit. There's an aspect around public consultation that was part of that, which made it difficult to do in the early stages of COVID. And they're now the current minister can inform you on where we are on Leahy.
Go ahead, Brian, with your follow-up.
Thank you. I want to ask you also about Northern Pulp. The company told a BC court in a document it filed, I believe, at the end of last week, that it intends to seek a settlement with the province over its judicial review application in February, which is the month that you're leaving office. I'm wondering, are you concerned the company is trying to wait out the end of your term?
No. I didn't actually read the document that was before the court. We have people dealing with that. No, I don't. I'm not exactly sure what it is you're referring to. I'm not trying to avoid your question, Brian, but I don't know what are you referring to? They're looking for a settlement on what?
Sure. There's a judicial review application. They want a review of Minister Wilson's decision not to give them approval, if you recall. They're saying that they will approach the province in February trying to seek a settlement on that matter.
Oh, I don't know what kind of a settlement they'll be looking for. We've made it very clear to them there's an environmental process forward that meets the environmental standards of today. I have every confidence in the department in their original ruling. And if the company wants to apply for another permit, there's a process for them to do that, but it will meet the environmental standards of today. And we as a government, not just me, we're committed to ensuring the environmental integrity of the operations that are in this province, and that would be my message to them or to anyone else that wants to come and operate in this province. You need to follow the environmental standards that we have set. If you choose not to, you will not get the privilege, quite frankly, to operate.
Next, we'll go to Tim Bousquet from the Halifax Examiner.
Yes, yesterday Dr. Strang laid out a timeline for the vaccine. A small number coming next week, 150,000 by the end of March. That's the circle of people getting the vaccine expanding over the summer, but not everyone getting vaccinated until the fall. I'm wondering, was that timeline just related to the Pfizer vaccine, or could there be potential new vaccines? There's 3 or 4 in the pipeline, and would that speed up the timeline?
I don't want to speak for Dr. Strang, but yes, I would say to you, all of the things. There's only one vaccine that's been approved by Health Canada. There's only one vaccine that I know of globally that's being used, and that's the Pfizer one. But you're very right. There are other ones that are very close. Is my understanding. They're working their way through the process. If one of those is approved by Health Canada, that will make that the rollout happen much quicker. Obviously.
Go ahead, Tim, with your follow-up.
Okay, I guess it's just pretty obvious, but that should be a note of optimism then for people out there.
Very much, very much. We're optimistic people here, for sure.
Next, we'll go to Avery Mullins from The Signal. Go ahead, Avery.
Thanks very much. So we know that the Pfizer vaccine is going to be arriving quite soon here. We also know that the Moderna vaccine is slated to arrive in Nova Scotia. Is there a strategy or a breakdown for who's going to get the Pfizer vaccine and who's going to get the Moderna vaccine? And is it going to be at all related to geography in terms of access to the cold storage for the Pfizer vaccine and freezers and that kind of thing?
No, First of all, we have to. I don't know about the Moderna one arriving. That it would all have to be approved by Health Canada, and I don't know where that is actually in that process. Pfizer is, and it'll be here. I think it's important to recognize this first 2,000 that are coming. They're obviously coming directly to where we have here in HRM. It's obviously where the bulk of our people are. It's near our two regional hospitals in Attabicay, the infirmary, all of those facilities, the healthcare teams that are in and around this. So it'll be easier for us to really do this first run with this 2,000 to identify any issues that we may have, as well as being able to administer it very quickly. It'll be administered in, within days of arriving here. We'll be finished. And as I said to one of my earlier questions, we're actually looking at, we have procured other freezers of this type. And we've had people offering them to have them actually in their premises for use. So we've got them, we'll distribute them around the province. So if Pfizer is the only vaccine that it gets approved by Health Canada, we will have the infrastructure to be able to move that in and around the region to be able to deliver the vaccine. But in the meantime, if for argument's sake, if we ended up getting a large shipment of vaccines, the fact that we're doing, the healthcare teams first, almost all of them are mobile. They can come and we can deliver that anywhere in the province, really.
Go ahead with your follow-up, Avery.
So on the topic of the different vaccines, there is a press release on the Nova Scotia website saying that the Moderna vaccine is expected to begin arriving this month, and of course there are a couple other vaccines in various stages of development that may or may not be approved by Health Canada. When people receive a COVID-19 vaccine in Nova Scotia, will they be told which of the vaccines they're receiving if there are multiple vaccines in use at the time they're receiving it?
Yeah, I don't know anything about the Moderna one. That's and there must be something put out by Health and Public Health around that. I do know that the Pfizer one is the only one that has been approved by Health Canada for us to be able to use now, and I'm not exactly sure where the Moderna was in that process. But it would be my understanding that whatever vaccine would be used, if you or I asked which one it was, we would that would be communicated to us.
Next, we'll go to Lindsay Armstrong from All Nova Scotia. Go ahead, Lindsay.
Thank you. Hi, Premier. I'm following a question from Jean yesterday. Why is it that we're prioritizing frontline healthcare workers instead of long-term care residents, which is what the National Advisory Committee on Immunization lists as the top priority? I'm wondering if this is due to the requirement that the vaccines be kept close to its storage at this stage. And if so, can you tell us more about the potential plans for a transit beyond Halifax?
So partially the rollout is associated with needing to be near this freezer and obviously having the people here. There was no, it's been public health's position, one that I support, that frontline healthcare workers be the first to receive this. That would include people working in long-term care as we begin to roll this out. We will be providing it to residents in long-term care, but quite frankly, the residents who have gotten COVID is because someone else has brought it in. It's not because they've been out. It's been brought into them. So we want to make sure that we vaccinate the people who are working there. And at the same time, we want to make sure that our frontline healthcare teams who go to work every day, who have to prepare for COVID walking through the door at any minute, any second, regardless of what is being presented in front of them. We wanted to make sure that we protected them so that they could continue to care for and look after those of us who may require health care outside of just COVID, but the other aspects of the healthcare system.
Go ahead, Lindsay, with your follow-up.
Thank you. And in response to your previous question, you described additional freezers being available in addition to the two that are already at the province's disposal. Can you tell us more about these, who would be providing them and what capacity they have?
So we started, when we went down through this whole process, as we have through the entire pandemic, we started a procurement team led by Fred Crooks, who would be whether it was dealing with PPE or whatever required to get, he would procure that. He would work across our healthcare teams to see what that looks like. What are the things that required? So when it became time around this issue of the vaccine, we needed to make sure that we had enough swabs, enough syringes, all of the things that would be required for people to deliver that vaccine to us, and as well as freezers. And obviously this one at -80 is a unique freezer. We have some of those within our own infrastructure of the delivery of healthcare already. So it's the one we'll be using this next week is one that was with is in the system. It's here, so we're using it. And then we went to look at procuring others in case there were places in the province where we couldn't identify one. So for argument's sake, and they would know better than this, if there's not one in Cape Breton, obviously one of the ones we purchase will end up in Cape Breton. And so we would be looking around, our own suite of freezers that we would have, and then moving the new ones to places where they're required.
And that's all the time we have for questions today. Thank you, Premier.
Thank you very much.
For those reporters on the line, we'll take a 5-minute break before we set things up to start cabinet outs.